Imagine a system where a life-saving gift is available, but some people face significantly higher hurdles to receive it simply because of where they live or their socio-economic status. This challenge is at the heart of organ allocation, and thankfully, policy is evolving to address it. Organ allocation policies can significantly reduce health disparities by shifting their focus from solely medical urgency to include a broader understanding of equity and access. This means actively considering factors beyond just clinical need, such as socio-economic status, geographic location, and systemic barriers that historically disadvantage certain patient populations. The goal is to ensure that life-saving organs are distributed in a way that provides a fair chance to everyone, not just those with the most resources or best access to care. The why behind this shift is deeply rooted in the concept of distributive justice within bioethics. Health disparities in organ allocation often arise from a complex interplay of factors, including historical inequities in healthcare access, variations in insurance coverage, differences in health literacy, and even the uneven distribution of transplant centers. For example, previous allocation models based heavily on local geographic boundaries inadvertently favored patients in densely populated areas with more donors and transplant programs, creating a disadvantage for those in rural or underserved regions. Addressing these systemic issues requires a conscious policy effort to level the playing field, recognizing that equal treatment does not always result in equitable outcomes. To achieve this, policymakers are implementing several key strategies. One crucial change involves expanding the geographic sharing of organs, moving away from localized zones to broader sharing across larger regions, or even nationally, for certain organs like kidneys and livers. This increases the pool of potential recipients for each donated organ, reducing the impact of local supply variations. Additionally, some policies are incorporating social vulnerability indexes or other measures to identify and support patients who face significant non-medical barriers to transplantation. This can include targeted assistance with transportation, housing, or financial aid to help patients navigate the complex pre-transplant evaluation and post-transplant care requirements. These policy adjustments often involve a delicate balance of ethical principles, particularly utilitarianism, which aims for the greatest good for the greatest number, and justice as fairness, which seeks to correct existing societal inequalities. For instance, prioritizing a patient who has been on a waiting list for an extended period due to systemic disadvantages, even if another patient has a slightly higher medical urgency score, reflects a justice-driven approach. Furthermore, robust data collection and ongoing analysis are vital to identify and continuously refine policies, ensuring that they effectively reduce disparities without creating new unintended biases. It is about understanding the social determinants of health and embedding that understanding into the very fabric of the allocation system. Ultimately, by adopting policies that are sensitive to the social context of patients and proactively address systemic barriers, we can move towards a more just and inclusive organ transplantation system. This ensures that the incredible gift of organ donation reaches those who need it most, regardless of their background, fostering a healthcare environment that truly embodies fairness and equitable access to life-saving care for everyone.